Thank you so much. Welcome to our webinar presented by Manhattan Psychology Group. We're really thrilled to have you join us, whether it be live or asynchronously. Manhattan Psychology Group is a multidisciplinary team consisting of adult and child psychologists, neuropsychologists, special educators, BCBAs, and ABA therapists. And we provide comprehensive care from psychological testing services to ABA services to individuals of all ages. Our services are available at our Upper West Side location and Long Island City offices, as well as client homes, schools, and community locations. We offer various payment options, including private pay, commercial health insurance, and DOE impartial hearing options. All right, we can move on to the next slide. At MPG, our vision is to create a future where individuals and their families feel supported, connected, and empowered. Move on to the next one. Yes. And our mission at MPG is to provide multidisciplinary integrated support for individuals and families who experience mental health, behavioral, and educational challenges. Thank you. We can move on to the next. So thank you again for joining us today. Our topic is on family guidance, a focus on collaboration, communication, and ethical concerns. And tonight, our presenter is Bethany A. Garcia.
Thank you so much for having me, Andrew. I really appreciate it.
You're welcome.
Awesome. Okay, well, thank you everybody for joining in. I appreciate everybody coming in to kind of chat and learn a little bit. This is actually my first CEU ever presenting. I presented previously to other educators and collaborators and, teams that reached out for any further support in the behavior field, but this is the first CEU, so this is a check mark on my bucket list. So I'm happy to be here. So bear with me. We'll run through this. I've been told that I present pretty quickly, so I'm going to try to slow it down a little bit. And please use the chat, ask any questions, comments. Have your input in there. Andrew and I will communicate that piece back and forth. As I cannot see the chat, I can't monitor it. So we'll move on. Just a little bit about me. I currently live in Missouri. I am right in Kansas City, so I'm on both sides of the state of Kansas and Missouri. I'm currently a clinical director for an ABA clinic here. I currently serve about 15 children. I have about 20 staff underneath me, and we're quickly growing. I also provide remote supervision for a company for those students that are, gaining their experience hours. I've been in the field for about 16 years, started out because a really good friend of mine, her daughter was diagnosed at the age of 3, and I happened to be there when a BCBA was there, and it kind of just caught my eye. In this field, they say the field finds you, and that's absolutely what happened. And so from that point forward, I was interested in it, behavior, the psychology side of it, and definitely the scientific data side of it. I've practiced in home, in the clinical setting, in the community. I've collaborated and worked with schools and school districts and childcare centers. I've worked with telehealth and telemedicine, as well as some group homes and residential settings. I've had experience in OBM, remote and face-to-face supervision, and of course, family guidance. I have a pretty vast range of experience, and I've had some absolutely great supervisors and mentors along the way. So when I'm not working and thinking about behavior, I enjoy camping, being outside, road trips, off-roading in my Jeep, and reading. I do have 3 children, and my husband and I tend to spend a lot of time outside. So that's kind of what we do on the side. So we're going to start out the CEU, 3 learning objectives here. I'm sure that this information might not be new to you, but I really wanted the CEU to kind of trigger some of those brainstorming ways. Maybe, it's a setting that you haven't been in before, or a way to approach a topic or a really difficult subject. And it's always a great thing for all of us to come together and collaborate. So in our CEU today, learning objectives, learn helpful ways to effectively communicate behavior analytic strategies with caretakers and stakeholders. We know how important that piece of it is, and we know that not all of the time are we very welcomed, or do our stakeholders know or are educated appropriately, right? Or educated about all the good things that we do. So the second objective is discover additional tools to assist with collaboration with caretakers and stakeholders. So that collaboration piece, it can be anything from obviously our families, or if they have extended family living with them, or nannies or babysitters, grandparents, collaborating with schools, of course, and then other professionals that we work with and come across with. The last learning objective, sorry about that, is a focus on ethical considerations while we're providing that support to the caretakers and stakeholders. I know that there's a lot of things that we think about, and our ethical guidelines are really specific, but there's a lot of cultural things too, and really to kind of take this stand in a very compassionate way. So before we start going into our communication, there's actually two things that I wanted to talk about. One is I wanted to talk and kind of throw it out there. And if you would just go ahead and comment in the chat, tell me what kind of setting you're in, whether it's a clinical setting, whether you're in a school district, whether you provide services at home, or maybe you're in the supervisory role, or you're working remotely. I just kind of wanted to get a feel for where everybody was practicing. Okay, Andrew, I'm not seeing it, so.
Oh, yeah, it seems to be that there's a lot of mix between home and school, clinics, private clinic, home,
Excellent.
public school, sorry, adult services, daycare, group homes, home,
Excellent.
school, telehealth.
Nice. Nice. Excellent. I love that. I love that there's such a broad range of settings that we can work in and we can apply our skills in, right? Because that just means the more we disseminate, the more we support, and the more knowledge people have, which is fantastic. So when we do communicate with our caregivers, our stakeholders, we want to make sure that we're using clear and effective language. We are very objective, right? We make things very clear, but there are times where we use very technical jargon. And you'll hear me talk about this quite a bit because I think it applies in so many different ways. So clear and effective language from the very beginning of when you're doing that intake on a client, or you're communicating with a family, even on the phone or in person, we want to make sure that we're extending our communication. We are explaining what we do, how our services look, what our goals are, and making sure that we're clearly communicating that. Explanation of plans and goals, taking the time to sit down and really break it down and talk about our core deficits of autism that we're going to focus on, or our social skills, our play skills, communication skills, all of those. A lot of parents, they may have recently received a diagnosis, or it might have been, long-term a while back. And so they may just be finding out about ABA or taking the plunge to talk about somebody with ABA. We're going to go ahead and we're going to take a poll for any kind of interaction with you guys. We're going to have a little bit of explanation of ABA in general and expectations, level of support that's needed for that particular family or individual that we're serving, and then resources for families, because that's really important as well. Clinical recommendation, and then misconceptions. I think that part of it is really big when we're talking with our stakeholders. So here we go. We're going to talk a little bit, go ahead and throw that in there. Ways that we can relate to our families, ways that we can communicate clearly and build rapport. What is it that you have found in your practice that you have found to be really effective, that you have found to help build that rapport with your families? This is something that we talk about, rapport with our clients. We talk about instructional control, but I think it's so important for us to build that rapport and to communicate clearly with our families. So throw it out there, give me some information. Tell me what are some of those strategies that you have done with families.
So I'm gonna just fire a couple
Yeah,
of answers. Courtney says be personable. Um, Someone said communicating long-term goals, showing empathy and relating to parents, using no jargon, showing up consistently, validating feelings,
I love it.
listen, let them talk. I like that one. Just really listen to them.
Yes, I love that.
Yeah.
I love that. It looks like too, we have a couple of questions in our Q&A area, Andrew. I don't know if where that relates to with communication or what, but just to kind of give a heads up.
Yeah. They were responses to previous questions, so
Oh, great.
it's on for
Great.
now.
Great. Thank you guys.
Yeah.
Yeah, I love that. I love hearing a lot of those things, right? Be personable, be real, be transparent, be empathetic, be compassionate. Some of us like may or may not have been in the situation of having a child with a diagnosis or having a child that is neurodiverse. And some of us may be able to put ourselves in that position and some may not be. And no matter what, there's a level of empathy, there's a level of connection that we need to have to build that rapport with our parents. It is one thing to have that with an individual that we're treating and we're serving. It is another thing to have it with that family so that way we can build that trust. So let's talk about clear and effective language here. We talked about like the jargon and the technical terms that we do use. We want to avoid that. Not everybody has the same type of education and background and understanding of behavior the way that we do. And so we want to make sure that we're using that simple and clear language to communicate with them, whether it is going over our treatment plan or just talking about how our session and how our treatment looks, expectations as well. So prepare ahead of time, know what the focus is of when you're going to meet with the family, have notes ready, outline or a draft. That's always really helpful because I don't know about you guys, but when I get in with a family, we start talking about concerns and progress and all these great things that happen. And maybe, you know, funny events and stories that the family want to share with us, or even on the flip side, some of those challenging behaviors. And sometimes we get off track. And even though we're focusing and talking about that individual or, you know, our progress and our data that we're collecting and our programming, it's always nice to have that outline in that draft and just kind of be prepared for that piece of it. Be mindful also about nonverbal communication. That is something that I have learned to do. Facial expressions, body language. And I think it's also important to not only be aware of yourself and how you're coming off and how you're presenting and how people can perceive that and those social cues that are in place, but also on the other side as well. Pay attention to when you're talking to your families and to your stakeholders, their expressions and their body language. I think that that plays a huge piece in that communication as well. I remember at one point I was in a family guidance with parents, and the dad just kind of sort of drifted off a little and was on his phone and I was like, okay, I'm losing him. I got to reel him back in, right? I want to pull him back in and make sure that he's involved in this treatment. It's so important for us to pay attention to not only our nonverbal communication, but our audiences as well. It's super hard to do this with you guys via remote and telehealth right now because I usually like doing this with people where I can see their expressions, or I'm always on video just because I think that that's so important. So this is a little off for me. I feel like I'm just, you know, talking to a screen for you guys. So, but yeah, I think also the delivery of our words and our tone and our inflection, especially when it comes to writing, you know, communicating via text or via email, we have had to do that a lot lately, right? Especially since 2020. There's been a lot of remote, there's been a lot of telehealth and telemedicine, a lot of communication with portals and via texts and emails. And so I think that that part of it also is really important to make sure that we're writing and we're coming across focused and there and in the moment, right? Practice active listening. Let them talk. I love that, right? Let them talk and listen and be there, be that sounding wall. Let them tell you their concerns, not interrupting. It is okay to make those suggestions. It is okay to acknowledge, however, that those active listening skills are so important when you're communicating and building rapport. So explanation of plans and goals. This is after we do that that initial intake, after we do that assessment, we write up our goals, we have our plan, and whether it's an IEP and you're in the school district, or whether it's a behavior plan or whatever it may be, reviewing that treatment plan, reviewing those domains, reviewing the assessment that you utilized. Assessments are foreign to some people sometimes, even to myself, that they're really hard to read results of sometimes, especially when you don't produce those results. They're automatically generated and produced for us. Yes, it's easier, but sometimes they're hard to read and hard to distinguish. Okay, where am I supposed to be? Am I supposed to be in a higher level or a lower level? Explaining those things and reviewing the goals and the plans are so important. Justification of why. This is huge as well. Making sure that the stakeholders and the families are understanding why we're targeting something and why we're working on something. It may be something as simple as tying a shoe. It may be, washing hands correctly, or it could be even something further as far as conversating with peers and picking up on social skills or those executive functioning skills. Very important as to why. I think this also goes, I have found too, with staff that I've worked with. If they have an understanding of why we're working on something and what those skills can lead to, it makes a huge difference. They understand why and the purpose of what we're doing. Provide examples that relate to the individual. It's so much easier for our families and for our stakeholders to relate when you're in a classroom and you have that child that is so full of movement and hard to sit at a desk and just work, right? Well, having accommodations for seating and having accommodations for frequent breaks, movement breaks, things like that, related to that particular individual that you're working with. They can understand that better, as opposed to, a child, individual who wants to learn by, working independently and working quietly. Explaining and relating examples to that individual that you're working with, it's going to go a long way as far as getting that buy-in, getting that understanding, and then you have that relationship and that understanding of how this individual learns and how you want to implement your programming. And then, of course, answer all the questions that they may have. And maybe you don't have the answers, and that is totally okay. And as long as you're working towards, I don't know that answer, but I have a support group, I have a mentorship, I have, colleagues and people that we work with here in the clinic. I truly hope that all of you have that support and that you have that circle that you can go to answer any of those questions that you may not have the answers to. And that's okay, because sometimes we don't. Okay, before we go on to the poll, are there any questions at all? Are there any comments, any input?
I don't have anything in the Q&A, but let's see if anybody has any questions. You could feel free to type it in the chat.
Cool, great, thank you. So going on to a poll, go ahead and pull into the chat. How many of you?
Okay, there we go.
Oh, great, nice. Yes.
So most are saying all the time.
Yes, that is awesome. And even if it's an initial plan, or, a reoccurring assessment, some of us do it every 6 months, some of us do it annually for IEPs. Those are so important to review. That progress is something that the family wants to know about, and what are we looking at in those skills and those deficits that are occurrent. That's awesome.
Oh, we do have one question, Bethany.
Sure.
Sora asks, what is the role of a behavior technician?
Yeah, so the behavior technician definitely has a different role than a behavior analyst. That behavior technician works directly with the individual and the client, and implements the programming and the protocol, depending on what kind of level the behavior technician is, as far as how long they've been in the field and have been implementing, or if they are a student and they're acquiring their experience hours, you can use those, or perhaps if your company utilizes a lead behavior technician, you can utilize them in many different ways. There is a definite scope. I refer over to the board, the BACB website, to help define that difference. That gives us a great difference between a behavior analyst and a registered behavior technician, an RBT. But that RBT is going to be up close and personal with that family, especially if you have, if you're in a home setting, and they will be working directly with that individual that we're serving and treating. That's a great question.
Yeah, and we have two comments, one from Jill saying it could be easy to stray from using simple language when talking on a topic you're passionate about.
Yes, agreed.
And Andrea says, I think it's also important to know what the parents want and how often they want to review the plans.
Yes, I think that that is a huge factor. Definitely, we'll talk about that in a little bit too, as far as getting the input from the families. How often do you want to meet for family guidance, and how often do you want to review progress? I know that a lot of us, and again, we'll talk about it later, but there's limitations on our payers, whether our funding sources are insurance companies or whether we are in a school district and we don't have to have that concern of a payer or an insurance company. There's a lot of different variables that go into play with that part of it, but ultimately the availability and the agreements and the expectation that you and the family come across, I think that plays a huge part in it too. How often do you meet? How often do you review those things? I always, whenever I do a reassessment or I write a new treatment plan or I update that behavior plan, the parents are like the first ones to get a copy because it's their child. They need to know how to implement it. They need to know those changes that we're putting into place. So yes, definitely important to take that into consideration. So thank you all for answering that and asking those questions. It's fantastic. All right, come on. Okay, so we're going to move on a little bit to the explanation of ABA, right? I really wish that there was, I don't know, and maybe it could be a goal of mine here eventually. I wish there was like an ABA 101 class for families, because I think that would be so great for them to just learn these simple basics, right? What is the timeline? What do services look like? How do I start getting into services? A lot of times I'll have families contact me and not even sure what ABA is, right? Not even sure what kind of services we are. And I know we all hear it. I know we all have had that experience before, especially when you're in the clinic. We are not a child care center, right? We may seem like it. We play a lot. We have cubbies. We sometimes have meals and snacks and lunches. But you know, we're part of that medical field. We're providing a service. And I think that it's really important to kind of stress that to families and just give them the basic information of what ABA is and what we look like, the timeline of an assessment from an intake to an assessment to getting an approval to starting services. And then, you know, it's not an overnight miraculous fix. It's not, you know, well, how long will my child be in treatment for? That's a really good question. I can't tell you that, right? I'm not sure, but we're going to do our best to make as much progress as we can. And I wish in that ABA 101 class, basics of like skill domains, right? Whether it's like communication and social skills, adaptive skills, and then the parents' role, especially in the adaptive skills, huge, right? Huge. A lot of parents are like, okay, drop off and go. Thanks. Have a great day. Awesome. But I need you to be a part of this treatment as well. I need you to be a part of this team so that way we can make the most progress and have the most successful outcome. Reinforcement procedures, functions of behavior, how important are those, right? And there are times too where I might say to a family, you know, this is going to feel very opposite of what your parent gut is telling you. This is going to feel kind of opposite. And it doesn't mean that we have to be strict. It doesn't mean that we have to use prompting procedures, physical prompting all the time. But there are a lot of ways that we can identify the functions of behavior. We can definitely implement reinforcement procedures at home without giving, you know, candy for every little thing. There's lots of different ways. And I really just like I said, maybe it's a bucket list of mine to create an ABA 101 class or even video or CEU or make it on a YouTube channel and just have it blow up or something. That would just be fantastic. Collecting ABC data and data collection in general. I'm going to throw it out there real quick too. How many of you, just yes or no, have your families or have your stakeholders collect data for you?
I mean, I can make a quick poll. Let's see.
Yeah, that'd be great. I think that it's important to be able to get our stakeholders, our families at home. I'm in the clinic setting for right now. And so I see what happens in our clinic setting. Of course, we're collecting data. We know what the individual can and cannot do with us or is able to do, or where there's difficulty or where they excel. But it's also another great thing to be able to get that collaboration from families and get that information from home. I think that piece is important. It is a little bit harder when you are in the school district setting. I know some schools do home visits, which is fantastic. You can get a glimpse of what the environment is like and the setting is at home. But it's so important to be able to just take that information. It's kind of like that, that daily check-in when they drop off. How did he sleep? How did he eat? That kind of stuff, but a little bit more specific to be able to get that data from home and to be able to know those behaviors that are occurring or what we're specifically targeting. Yeah, great. I love the fact that 3/4 of you guys are having your families and your caretakers and your stakeholders collect data. That's awesome. I love that. It goes right into generalization and maintenance, right? Generalization of skills with other adults, with a different setting. We are in a field where we work ourselves out of a job, right? We want to be able to give our families, our parents, the tools that they need. And then we want to make sure that they are able to have those tools, utilize them, and know how to respond and support their individual, their child, their, for ongoing long-term maintenance. So huge. Generalization in schools, going from one teacher to another, different classrooms, transitions. Are they maintaining those skills over time from the beginning of the year to the end of the year? Do they maintain it over a Christmas break or holiday break, winter break? Really important things to think about. All of these things I really, like I said, jam-pack want to put into a 101 class. I think it would be so useful. Fantastic. The level, sorry about that. The level of support needed. Here we go again. We talked about it earlier, the frequency of meetings. I have had structured meetings where we might sit down and we might talk about things, and I use behavior skills training. Again, we'll talk about that in a little bit. I've had different kind of meetings where it was more content, it was more structured, it was maybe a review of our treatment plan, or maybe a review of the IEP or concerns that they might have. And when we do those kind of meetings, and how frequent are we going to have those meetings, we need to be considerate of our caretakers and our stakeholders' time. Some of us may use curriculum and implementation procedures, right? There's a lot of things out there that are beneficial, behavior skills training, ACT, other structured curriculum, Ruby, things like that. Those are fantastic. And they're not always a one size fits all. You really, just like our treatment, it's individualized. And so sometimes we might find that some ways of teaching and some ways of supporting are more beneficial for our families than others. So we need to be cognizant of that piece too. Clear expectations. Okay, we're going in, we're going to talk about this today. Let's talk about challenging behaviors. Let's talk about his adaptive skills. What about nighttime routine? Make sure that we have topics that we stick to when we go in there. There are times where I've had family guidance meetings in home. It was in vivo, let's say, with the family. Everybody was there. Our client was there, and I'm supporting dad, or dad would talk to me about some concerns that he would have. And when I would go into the home, it would be a very hands-off kind of atmosphere with dad, where he wasn't involved, he wasn't participating. And I quickly realized I needed to go in with almost like an agenda, with almost like a clear topic of, okay, this is what we're coming in to work on today. I would really love to see how, the transition from dinner to bath to bed look. I want to know what that looks like. And sometimes we have to be more direct that way with our families. Sometimes we can go in and families just function and go along as we please. And, we can provide that support and we can provide that feedback right away. But there are other times where we need to be a little bit more structured and more direct with what we're looking for, especially when it comes to the concerns that the family has. Resources. We have a ton of resources out there. We are very evidence-based. We are very research-minded, right? And so support groups, blogs, research, articles that sometimes we can get lost in, but we can also print up and use with our families so that they can kind of see what's going on too. Videos and learning ABA principles, all of those, so many resources. And then I need to move my thing, sorry. Setting goals for caregivers. Again, this is exactly what I was talking about before, where maybe we have to be a little bit more direct and we have to make sure that they are on target with, okay, these are the concerns. This is what we're going to target. I'm going to collect some baseline. I'm going to go in and see how this looks. And then we're going to talk about reinforcement. We're going to talk about prompting. And then we're going to go ahead and collect data and see every time we go in for any kind of family guidance or parent support, what that looks like and how our treatment is working for that family, and if we need to change it up or if it's effective or not. Any questions for anybody at this point? Hey, Andrew, were the code words taken out? Is this the set that it doesn't have it?
No, it has it here.
Oh, it does. Okay, great.
Yeah, we just haven't gotten to it yet.
Okay, cool. Okay. So understanding the diagnosis, these are all resources that would be beneficial. Educational supports, support groups, medical and dietary supports. We all know that we have to rule out medical variances prior to any of our behavior principles or techniques being effective. And there are times where I've had to refer maybe to an SLP or refer to maybe a GI doc to make sure that, toilet training, we're not having any progress in this area. Let's go ahead and look in and make sure there's nothing medical wrong or concerning. Sometimes I've had to do that with neurologists as well. And so any of those supports for families, cultural resources, such a huge big one, right? And then additional therapies, like I said, SLP, OT, PT, always great to collaborate.
Yeah. Bethany, we do have one question from
Sure.
Amanda. She's asking, is there a specific curriculum we can use for parent training? I'm a parent trainer and I find it difficult to find materials and often have to make my own.
Yeah, a lot of times we do make my own. I don't use a curriculum. I usually use those behavior analytic ways to teach and techniques like behavior skills training. There are quite a bit of structured curriculum out there. If you are with a school district, if you are with a clinic, I would definitely talk with your supervisors, your other educators, your whoever you're with there, your management, your leadership team, and see if there's any that they would suggest or would prefer for you to use. I know Ruby is a really good one. I've seen it, I've not utilized it. And I'm sure that there are others. We can throw it out there. Who uses a curriculum? Go ahead and throw it in the chat. Who uses a curriculum and what ones do you use? What ones do you like?
Cecilia says that she uses BST, which I'm also a big fan of, behavioral skills training. Jessica says we use Ruby, RUBI.
Yep.
Another one for BST, BST, RUBI, making our own. I think like a mix of all of those are a really great combination.
Yeah, I completely agree. And it's not, like I said, it's not a one size fits all, right? You're going to find how your parents or how your families learn the best, and you're going to adjust and teach and support that way. So yeah, great question though. I think it all just depends on what you're comfortable, how you're comfortable, and how your family is receiving that support. Thank you for asking that. So when we talk to our families, we also talk about clinical treatment recommendations. We talk about the recommended number of hours, and those things that affect our treatment recommendations is the availability of our staff. They might want to have only afternoon, evening because of the individual being in school. And maybe, we're looking to staff that time frame at that point. So the availability of staff comes into play. Availability of the family also comes into play. We have families that aren't, they have multiple siblings or they have a lot of things going on, extracurricular activities. And maybe, certain times of the day are a little bit off limits, especially when you're a home provider too. When you're in home with the families, it sometimes can be pretty awkward to be sitting there during, dinner. But when we're targeting those adaptive skills, when we're targeting that, that critical time frame that might be necessary for that individual, being at home. So the availability of the family in the home and the availability of the family for when they want to have services and treatment, that's a huge consideration for our treatment recommendation. Cost and insurance limitations. those also come into play. Like I said, I'm in a clinical setting, and our payers are insurance companies, and there are many different plans that help cover it 100%, and then some that don't. There's quite a bit of copay depending on the service or frequency of service. I see there's another question in there.
Yeah, we have Shannon who asked, what do you do when family's availability does not match recommended treatment hours?
I love that question because it's going to happen. I think I think there's a couple of things that we can do. If you're in a clinic setting and the hours and the availability don't technically match up, we want to make sure that our treatment is effective, right? We want to make sure that what we're doing is going to be effective, and maybe 10 hours for an individual, depending on age and depending on developmental functioning level, maybe 10 hours a week is effective. But if your recommendation is, say, 30 or 20 and they only have 10 hours of availability, then maybe, and it's okay to say this, maybe you're not the appropriate setting or provider for that family, right? Maybe they would be better with a home provider, so that way they can go in there and have those extra hours and that extra time at home and get the support that they need at home. There's a lot of things to think about when it comes to that. But when that availability doesn't match up with your clinical recommendation, it doesn't mean like, okay, you're not the one for us. Sorry. You can negotiate, you can talk, you can come to an agreement, you can try to make the best things work. I mean, that's what we're here for. We're here to support these individuals and families. And it doesn't have to be an instant, okay, we're not a great fit. Sometimes you're not going to be a great fit, and that's okay. There's other providers. That's part of our ethical duty, right? That's part of our ethical concerns, is to be able to provide other resources and refer them out if we need to. Okay, any other?
Yeah, we have a bunch of questions, but I'm just trying to keep track of time. So maybe we can get
Yes.
to some, we have plenty of time for Q&A at the end.
Yes. Let me go through here. Okay, so clearing up misconceptions. Let's talk about some of the stakeholder views of ABA. Are those views accurate? Growth in ethics, research, and compassion, the company, payer, personal practices, discuss our current ABA practices, and then any questions. So here's our first code word. We're 37 minutes in, but that's okay. Code word is Skinner. Go ahead and make note of that first code word.
Yeah, we'll give everybody another few seconds.
Awesome.
Make sure a reminder that there are 2 code words for this webinar that you have to put in at the end of the webinar in order for you to get your CEU.
Great. Awesome. Thank you, Andrew.
Yeah, cool. You can move on whenever you're ready.
Yeah. Okay. So ways to build rapport, really huge, right? Because we want to be able to do this with our stakeholders and with the people of our team. Priorities of focus, the language that we use, we've talked a little bit about successful outcomes, the type of support that we can provide, and then that cultural consideration. So ways to build rapport: eye contact, open receptive body language, active listening, like we talked about earlier, connect with common situations, show compassion, right? No judgment, validate their contributions as part of the team. They are a major part of the team. They need to really be able to have a say in their individuals' programming and what we work on and what their concerns are, showing that compassion and demonstrating empathy. Again, we might not all be in that situation or have been in that situation, but we are in a field where compassion and empathy go a really long way. Listen more and talk less. I love this because it kind of reminds me of Hamilton, right? Where he's like, smile more, talk less. Absolutely. We really need to make sure that we're listening, understanding the stressors at home, the home environment that are occurring, the stressors of the socioeconomic status, right? Maybe we have a single family home, a single parent home. Maybe we have a parent that is absent because they're working multiple jobs. Maybe we have a blended family. Maybe we have other children or individuals in the home that have disabilities as well. All of those are stressors that can really impact rapport and impact treatment. Most of all, be patient. Our information is news. This does take time to learn, right? This isn't something that we learned overnight. And this is a process for a lot of our families and caretakers. And then using that behavior momentum and shaping behavior for parent skills, really, really important. So that way, all of these together can help really build a positive relationship, a really good rapport with your families to have that more successful outcome. Priorities of focus. I love this. Focus on strengths versus just the deficits. We'll get to the critical deficits. We'll talk about those targets. We'll talk about those goals and those programming focuses that we will have. We'll talk about the challenging behavior. Trust me, we will. But let's talk about the strengths and the abilities that these individuals have. Even if I'm with an individual for an hour or hour and a half for an assessment, we pick up on those strengths immediately, what they can and cannot do. Let's talk about what they can do. Parents always want to hear that. And that definitely should be a focus in our guidance and breakdown of treatment and plans and goals and things like that. Explain in a way that everyone understands, right? We talked about this jargon. We can easily jump into it, especially when it's a field that we're passionate about. I love that because we've learned it. We've engrossed ourselves in this. We've taken the time. We've made this a career. And it's really easy to start using some of those technical terms when we're talking and explaining our treatment plan and our goals. So rapport, in order to get those successful outcomes, we want to talk about and looking at the generalizing skills at home, generalizing other people with other people, novel adults, increasing positive behaviors at home. It improves relationships, right? We want to be able to help our families manage stress and difficult outcomes, overall higher quality of life. That's what we're in it for. We're in it for more independence, for more quality of life, for a positive behavior and positive interactions at home. It improves those relationships, ensure the needs and the values match the treatment goals. I think this is so huge. This is where we get the input of our families so that we are targeting these things, these concerns, and matching the goals to the skills and the values of the families that we're serving. So important. Effective treatment provides higher buy-in, higher success rates, right? This is all things that research has shown us. Types of support. We've talked about in vivo, being there, being present when the individual is there, supporting the parents while they're implementing at home, out in the community, through natural environment, natural activity. That is where we want to be. We want to be there supporting in the moment when it's happening. There's also that structured type of support that we can provide. Individuals may or may not be present at this point, right? But we are able to have this opportunity to be able to support and to teach and to provide examples and methods and ways and techniques to have that family and have that parent, implement some of these behavior analytic skills. Of course, behavior skills training, a big fan. Acceptance and commitment therapy, really, really good as well, especially when you have older individuals that you're serving. I've used ACT, I've used ACT quite a bit with some of my teenagers. It really is helpful. Any of these ways, whether it's even the structure, the curriculum type of parent training, BST, ACT, all procedures lead to that independence for families, implementing those techniques outside of the therapeutic setting. Very, very important. Supporting the families even further, ensure that parents' concerns are priority, and answer and ask frequent questions. I think it's really important to seek to understand their biggest challenges. We want to make sure that we're asking them questions as well. Tell me what that looked like. Oh, he had a really hard day. Well, what does that hard day look like? I want to know. What was it? What did he do? What was that topography? What was that? What did it look like when he engaged in this? Or, oh, we had a really hard time opening the cap of a toothpaste. Okay, let's figure out what it is. Simple little things to bigger challenging behaviors. Giving parents information and instruction on how to implement at home, delivering that feedback with modeling the protocols. Really, really important. It is one thing for us to say, okay, great. Now you know what ABCs look like. You know what the antecedent is. Go ahead and go at home, figure it out. Let me know how it goes. They could be completely lost, right? talk them through it, support them through it, deliver that feedback. We know immediate feedback is most effective. Modeling the protocols with them, so important, so important. Following up with the families, provide times to meet and discuss progress, hold consistent meetings. Again, take into consideration their time and their schedule and how busy their life is and the stressors that come along with it. Discuss when it's most convenient for the family to meet with you. Using that simple language and terminology, questions, questions, questions. Both sides, ask them, answer them. Really a priority. Understand and listen to the family when you're asking those questions. Hey, how are you doing today? Oh, I'm awful. Oh, awesome. Great. Good to hear. What? Did you even hear me? Did you even listen to me? It's just that simple. Listen to your families. When they come to you, they're seeking help. They're seeking that support. Chat time. Okay. What are some of the cultural considerations we need to be cognizant of? I'd like to know, shout them out there, put it out there. Tell me a little bit about some of those cultural things that you've thought about, especially when you're working with individuals, cultural differences, biases, and in different settings as well, right? In the community, school districts, things like that.
We have someone who said roles of gender, language barriers and cultural beliefs, specific diets, ways to eat food, religion, language barriers,
Love it.
diet. All of these I have experienced also.
Yes. Yes.
Eye contact, really good one.
Great.
Taking
Yes.
shoes off, yes.
Yes, definitely.
Gifts can be tricky.
Yes, they can, right? Make or break a relationship, really, in some cultures.
The stigma of having a child with a disability, absolutely.
Yes,
It's all
that's,
really big
that's a great
examples.
one. Those
Mm.
are great. Those are excellent. So let's talk about some of them. You guys hit the nail on the head. Language barriers. This is actually pretty cool. Dietary or reinforcer restrictions, routines and family culture practices, values, belief, religious practices, cultural differences with consequences as well. Like, do they put in consequences? Do they tell the individual no? Do they put, punishers in place? So parenting, just parenting styles in general, right, can be very different. So when we're collaborating with families and other professionals, ethics that blend with both populations. Okay, so I'm going to go back a little bit here because I think that this kind of jumped a little bit for me with these slides. So language barriers. Let's talk about that real quick. I did my first assessment the other day and I had an interpreter with me and it was phenomenal. And I've never done that before. It wasn't awkward. The interpreter came and arrived at the clinic first, and I was able to talk with her a little bit. She was super friendly, and I kind of gave her a heads up on some of the things that I was looking for, concerns from mom, questions. Did she know about ABA? What was her biggest concerns with the individual? Just those kind of things. And it was great. I've never done that before. And I thought that was such a cool opportunity, such a cool opportunity to learn and to interact and, to make sure that what we wanted to get across was getting across in their native language so that it was completely understood. So really, really cool. I just love that. Dietary and reinforcer restrictions, huge one to think about, right? Especially with religious and beliefs and values and practices. Always make sure that we're taking that into consideration. Routines and family cultural practices. There could be times for prayer. There could be times of fasting. Those are the things that we really need to think about. So I just wanted to touch base on that. And I did want to say about the interpreter, because I just thought that was pretty cool. I don't know how many people have had that opportunity, but we loved it. We absolutely loved it. Okay, so when we talk about collaborating with families, other professionals, ethics that blend with both population, right? Those ethical considerations, both populations, meaning those professionals and those families. I kind of wanted to make like a Venn diagram, because it kind of overlapped so much when we talk about these. We talk about the cultural pieces of it. We talk about personal biases that we may have. Are we the right fit for this? Do we think any of our personal biases are going to come into play and play a role in how we treat and how we interact with our families and our individuals? All these things to kind of think about when we are collaborating. Who do we collaborate with? other members of the community, school districts, school staff, therapeutic professionals, speech, OT, PT, parents and caretakers, of course, previous providers and future providers. That's always really important. We don't know why sometimes maybe the family decided to change providers and go from one to another, or maybe a home setting is more beneficial. And so I'm transitioning from the clinic to the home setting. We have to collaborate. We are all on the same team, and that team is to be able to be successful for these individuals. So really, really important. Be kind in our feedback, right? In our suggestions, in our ideas. In the beginning, I was a baby BCBA, and I was with a mentor, and we went into an IEP meeting, and the mentor went in with guns blazing, and we got nowhere in that meeting. And I think that was one of the biggest lessons I've learned right off the bat. And I think it was so valuable, where sure, we might not always agree with school districts. We might not always agree with some of the things that they put into place. We know that their IEPs and their goals are written a little bit differently, and that's okay. And we don't have to go in and change everything. And we don't have to go in guns blazing, but we can give our suggestions and our ideas and our feedback in a kind way, where we don't just, go in and want to make all these changes. The other piece that I've learned with that is the language that we use, both verbal and nonverbal. I'm very transparent. You can tell when I'm upset. You can tell when I'm concentrating on something. You can tell when I'm mad about something. It's hard for me to hide and disguise this. And a lot of times I don't, but I am very cognizant of that nonverbal language that I put out there. And I want to make sure that we are on the same team when we are collaborating with other professionals, that we maintain that rapport. We're not always going to agree. We're not always going to see eye to eye, and that is okay. The information and the resources we give also, I think that's important to kind of think about, where sure, we might be scientific and we might be very analytical and we might be data driven and evidence-based practice driven, and maybe not everybody else is, and that's okay. And we can give them those resources and we can give them that information, but it doesn't mean that we have to, push it really hard to make it aversive, right? We need to make sure that we have active participants when we're collaborating, active participants in our treatment decisions, and it increases that buy-in and that positive outlook, that positive outcome that we want. So treatment decisions, I think, is so important to collaborate with. All right, so we're going to go on through here: collaboration with professionals, supporting families, meeting their concerns, agreeing with others on treatment, and not sacrificing our evidence-based practice. I think that part is really important. So here with our ethical considerations with both families and stakeholders, practicing within the scope and the role, respectful collaboration like we talked about, avoiding those dual relationships, right? Obviously maintaining our competence, practicing within scope and role and competence. Those are really, really important. We want to make sure we're not SLPs. Some of us are. I think that's really cool when you hold a dual certification like that. But wanting to make sure that we're putting in the input from our side and from our understanding, right? Selecting treatment goals with others and collaborating with others that are going to be in the best interest of the client. Be aware of your own biases, like I talked about earlier, taking on others' customs and cultures and norms into consideration, huge. Acknowledge the difference in cultures that you're working with, the customs of your stakeholders as well as others that will be part of the team. Very important to be considerate of them as well. Explore your research for the cultural competence, right? Reach out to other collaborators, supervisors, colleagues for that cultural understanding, so that way we can learn more. The more we know, the better we can do, right? Evaluate if accepting the differences, respecting the cultural practices, and removing any judgment during these services if possible. That is so huge. Remove the judgment, right? Everybody is different, and that's okay. And even though maybe our values are different, our cultures and our customs are different, we can still provide a very ethical, very comprehensive treatment, successful treatment. The next code word, compassion.
All right, so this is the second and last code that you need in order for you to get your CEU certificate. I had just sent out in the chat a link that you will use in order for you to get your certificate. So we'll give you guys another second or so to write down this code. And again, just make sure you click the link in the chat.
Awesome.
I'll send it again. There you go. And when you close out of tonight's webinar, you will hopefully be redirected automatically to the survey link as well.
Great. All right, I'm going to move on as we have.
Hold on. Sorry, guys. Everybody's saying I don't see it. Okay, now it's up there.
Sorry.
I know. Everybody's like saying, I don't see it. Sorry about that.
No, okay. Thank you for monitoring that, Andrew.
No problem at all. So yeah, second word, compassion.
I always get nervous when I do these things. I'm like looking at it like, did I spell it right? I hope I spelled it right. Wouldn't that be funny? All right, let's move on. We've got 5 more minutes or so. So final thoughts, and then we can get to some Q&A just for a couple minutes. When we collaborate and we communicate with our stakeholders, we're building a relationship of trust and knowledge and compassion, right? We are making changes in lives, positive changes that are built on education and empathy. We use this time wisely to create the best outcome for our clients. I think that is so huge. You have this little snippet of time to make a difference, to help improve, to help support, to help understand. We need to use that time wisely, right? We need to make every minute count. We need to make sure that we are focusing on those changes and our relationship that we're building along the way. And then I have some resources on the last couple of slides posted. So let's answer some of those Q&A. I love having questions.
Okay, so we have, what are some examples of resources you typically recommend to families?
Yeah, so I did talk about this a little bit. There are a lot of resources out there. We know that there is a ton of stuff to access now with social media, right? And not all of it is always great. Not all of it is always accurate. But I think using some of those resources, books that can be recommended out there, research articles on topics that there are some articles and topics that are written specifically for families, focused on that audience and that population. So that way it's more understandable and utilizable and relatable even to some of those families. I think it all just depends on what kind of resources and what kind of families that we're talking with and who's asking for the resources, right? There's a lot of great family type guidance books that are appropriate out there. Vlogs now are really great too. And then of course, our evidence-based practices. There are so many. There's a lot in my head. I don't want to just name them out there, but lots of resources to access.
Thanks. So we have another question. Let's see. How do you talk with a parent who spanks their child during telehealth home services instead of sticking to the behavior plan? Yeah,
that's a tough one. That is really difficult, right? This could be down to a cultural thing. I mean, it's a huge red flag to have a physical punishment like that. It is best to address it directly. I would be really clear and transparent about it. If it's not part of the behavior plan, it's not to say, maybe they won't engage in that behavior when we're there, and they might engage in it still when we're not there. I think that there's a fine line of people who agree with it, disagree with it, physical punishment, right? Borderline abuse. There's a lot of, we're mandated reporters. And so if there's any of those red flags and those gut feelings of, okay, this is not right, this is not okay, then, we're mandated reporters and it's not our job to investigate it. It's just our job to report it, right? But I think talk to the family directly, alternatives, replacement behaviors, alternative ways to discipline It can be extremely harmful, just the same way that, if it's not, I don't even want to say if it's not used correctly, but like timeout, if it's not used correctly, it's not effective. It's not effective. And so educating, providing, there's even ways that you can recommend and resource. You can go ahead and resource and recommend maybe even some counseling or, therapy within that. It's a tricky situation. That's a really hard one, but I would definitely have alternatives and I would address it very clearly. It's a great question, but it's a very difficult one.
Yeah. Hey, you want to take one more question?
Yeah, one more. That's
Okay.
not anything spanking.
What are some MNC or medically necessary criteria tools used by others to guide how treatment hours are identified or recommended?
Ooh, so it also depends on your payer or your insurance. They have medical necessity guidelines. And so you hear a lot of, well, we don't, academic wise, we don't work on this because it's not in our scope or it's not our job to be, focusing on academic goals and things. I would say if you have payers, if you have insurance companies that you are getting your authorization from, go that route, look up their medical necessary guidelines. That's what I typically use to guide our programming. That's a good question too, because that's really difficult as well. But there's information out there, there's guidelines out there, and definitely talk with your mentors, your supervisors, your leadership team for sure. They will guide you. Awesome.
Yeah. All
Thank
right.
you for those.
Yeah. So thank you so much, everyone, for joining us tonight.
Yes, thank you.
Yeah, that was very informative.